what is a sign to go look for a chiropractor during my pregnancy?
The first sign would be that you found out that you're pregnant. And if you don't have a chiropractor, I strongly suggest that you find a good wellness chiropractor in your area to support you through the whole process. Significant signs that you should also look for would be pain, of course, particularly radiating pain, sciatic pain down the leg, numbness, tingling in the hands or the feet, significant increase in tension, pressure, pain in the neck and shoulders, or an increase in headaches or starting to get headaches. These are all signs that the spine isn't handling the changes that are happening with the changes to the body. So the short answer is, the first sign would be if you're pregnant. The second, longer answer is if you're having some of these significant symptoms, of course, go get those checked out by a qualified wellness chiropractor as soon as possible.
Is it safe to get adjusted during the whole pregnancy?
A lot of women are concerned about the safety through their pregnancy, and they're concerned and should be concerned about any type of medical or health intervention. So great to ask these questions. The most important thing to realize is that chiropractic is one of the safest forms of healthcare. It's natural, it's drug-free. There's specific techniques that we use through the pregnancy as the baby grows and develops. We need to make changes to the adjustment styles that we use. So the adjustments are very, very different to what you might have if you're not pregnant or if you're an adult, and they're tailored to suit you. So they're typically more low force. We use the activator, Webster technique, a lot of applied kinesiology, these type of things.
So basically I could get adjusted one day before I deliver a baby.
Absolutely. We're often adjusting women every day up until the labor.
This is a good one. Will it help my morning sickness?
Yeah. A lot of women with morning sickness will do anything to get some relief. Chiropractic helps by improving the spinal health and thus improving nervous system health. The nervous system, particularly the vagus nerve in the upper neck, is what basically sends signals down to the stomach and can give you that nauseous type of feeling. If you've ever had butterflies, that's what's happening right there. And so when we find women, if they've got an upper neck issue and they're having a lot of morning sickness, these are the women who respond very well to chiropractic care during the pregnancy. There are many other causes for morning sickness being quite severe, but if it's coming from a neck issue, then women who start chiropractic care are going to get a lot of relief.
I really want a natural birth. What can I do to make that happen?
Okay, so obviously there's no guarantees in life, but what I see a lot of women do is they'll say they want a natural birth, but then they'll do things that will basically stack the odds against them from having that. And so if you want a natural birth, you want to have practitioners who are with you throughout the entire pregnancy and delivery and postnatal as well, that want you to have a natural birth, and that's where their expertise is. So make sure that you have a midwife that's looking after you. Make sure that you have a chiropractor that's looking after you. It's a good idea to also have a naturopath if there's also some significant nutritional things that need to be looked after as well. So if you want a natural birth, have natural health practitioners on your team who are primarily looking after you, and then you use the Western medical system if there's some type of emergency situation.
So how can chiropractic help with a natural birth?
Well, chiropractors are natural health practitioners. Our whole philosophy is when the spine's well aligned, the nervous system can function correctly. And so our job is to detect issues in the spine and pelvis, align those through gentle, safe adjustments, and that actually allows the nervous system to work better. And the nervous system is what governs your health. It governs every function in your body. So when the baby is developing in the uterus, we need a lot of room for that baby to develop correctly. And so when there's imbalances and contortions in the spine, that baby in that uterus is actually not in the best position, and so the baby can be constricted, can't move freely. When we don't have normal, particularly lordosis curves, so in the lower back we should have a nice curve there, and so if that curve's not there, then baby basically, once again, as it's growing, is going to put abnormal stresses and strains on the pelvis, on the spine. And so when it comes time for delivery, the baby can often not get into the right position. It can be very difficult for that labor to go ahead. And so this is when we find that women basically don't progress in their labor and they can end up in C-section, or baby can kind of get stuck because the pelvis is constricted, misaligned, and we don't have good nerve supply to the uterus muscles, and so then forceps and vacuum, other interventions can come into play in that point. So chiropractic helps not only the mother but also the developing fetus as well.
I'm already in my 3rd trimester. Is it too late to start?
Okay, so this is very common. A lot of women do, I don't want to say leave it too late, but they leave it to the last minute. So don't ignore those signs and symptoms that we talked about earlier. If you're having those, get into the chiropractor as soon as possible. Or if you fall pregnant, get a midwife, get a chiropractor, get the right people on your team. To specifically answer that question, absolutely not. We have women who literally come in past their due date. There's a lot of good research that shows that chiropractic can help the labor progress. But although we're not going to have a huge amount of correcting significant older issues and imbalances, there are certain techniques that we use, like Webster technique, that actually does help baby get into a position if we're seeing a breached baby, and can help relieve some of the pain that obviously comes with labor itself. So we're not forcibly moving the baby, but we're actually releasing tension and pressure and relieving imbalances within the uterus ligaments and the pelvis to allow the baby to get into a better position. It's definitely not too late if you are in your 3rd trimester, but if you're not in your 3rd trimester, please come in sooner.